The study is suggesting that a large number of nurses across the nation are unhappy. 57% of the nurses that were surveyed in this study said that they were exhausted on the job, and some are even thinking about quitting the job.
We definitely need to be rethinking about what's creating this shortage and what are ways that we can alleviate this problem.
Burnout has always been a part of nursing, stemming from mentally and physically tough environments along with long hours. And the pre-pandemic nursing shortage has exploded post-COVID.
All of those things are challenging, but they're all modifiable as well.
A study from the American Nurses Foundation released last month found that 57% of 12,581 surveyed nurses said they had felt exhausted over the course of 2 weeks. 43% claimed they felt burned out. Just 20% said they felt valued.
What do you think are the contributing factors that are pushing nurses away? We're seeing many of them burned out.
So there's some factors like workplace safety that also come into play, as well as just general behaviors of patients and nurses feeling disrespected or that they're not seen as the equivalent of another healthcare provider.
Mingus also adds that some hospitals changed the nurse-to-patient ratios, meaning caring for more patients. 43% of those surveyed by the American Nurses Foundation said they were thinking about switching jobs. Quitting has crossed the mind of Dominic Hamilton.
And I thought it would be a beautiful profession to do that for other people.
She graduated from nursing school in 2017. Now works as a nurse in the ICU at St. Mary's Hospital in Arizona. But she says there's less of a team now as the nurse shortage grows.
What is more difficult is not having the support of our facility, our administrators, in order to give us the resources that we need to do our job well. We need more nurses. We need better working conditions in order to get more nurses.
Mingus says the interest in the field is not the issue. There were 60,000 qualified nurse and applicants turned away from nursing schools in 2022, according to the American Nurses Association, because class space wasn't available.
And the reality is that there's a severe nursing shortage, in large part because we can't train enough nurses.
As more nurses leave the profession, schools are not producing enough graduates to fill the gap. Mingus adds there's still time to change things for the better.
One is, of course, better pay, right? Secondarily, you could invoke better work-life balance through having more flexible schedules. Thirdly, we could invoke training for nurses to achieve mindfulness and de-stressing activities while in the position.
But it requires a lot of work, and the reality is, for some, change may not come soon enough. The expert told me that in order to fix the burnout and the staffing issues, there should be more training programs for other professionals in the medical field to learn to respect, to give more and better respect to nurses. Also, he said, a better infrastructure to create more opportunities for students wanting to get into nursing school, as well as to put more attention in the mental health of nurses.